Today we'll be discussing a topic that people usually do not talk about, and that is problems with emptying the bladder right after natural childbirth. There are two things to consider. The first one is after a natural childbirth, it's common for some women to experience discomfort, kind of like stinging or burning pain while going to bathroom. This discomfort is often caused by the changes and strain that the pelvic region undergoes during labor and delivery. As you might know, the process of childbirth causes temporary trauma to the delicate tissues in the pelvic floor, which can result in sometimes small abrasions, minor tears, or sometimes not so minor tears, and you might have to get stitches, or they might be also be swelling, and all this cause the stinging or burning sensation to a certain level, depending on how the birth went. So you might feel such discomfort in the days following childbirth, especially the first few bathroom visits. Now, what can you do to elevate this pain? When you go to bathroom, you might want to use some lukewarm water on your sore areas while emptying your bladder, or do it in the shower so that it's not that painful. Usually, maximum after a week, you will heal and not feel any discomfort. Although this all discomfort is typically temporary and should improve over time, it's very important to maintain good hygiene and follow any postpartum care instructions provided by your doctor. If you experience severe or prolonged pain, urinary tract infection symptoms, or any other concerning issues while going to bathroom after childbirth, it's very, very important to seek medical attention promptly. And the second thing you need to know is that natural childbirths temporarily affect the perception of bladder fullness. So you do not feel the need to go to bathroom even if you have to. And this usually happens immediately after birth, and this might last for a few days, but depends from woman to woman. And this happens because after natural birth, your tissues and your organs down there are still sore and numb after the birthing process, and you might not feel the sensation of needing to empty your bladder or your bowel. It might also happen when a woman has received an epidural or other forms of anesthesia, so she may not feel sensation as normal. This is why nurses at the hospital might remind you, or in my case, force you to go to bathroom. After my first childbirth, a nurse came in after about an hour and asked me to go to bathroom. And since I don't like to be told what to do, I just said I will do it a bit later. And I was kind of dismissive. And that's when she explained it to me, that it is important, that it's a hospital policy to get women to go to bathroom even if they don't feel like to. And also she told me that if I won't be able to go to bathroom, she will have to use a catheter. I had no idea what it was, but when she explained it to me, I was like, I'm on my way to bathroom, no need for that. Proper urinary function is important for postpartum recovery, and nurses often encourage women to empty their bladders regularly after childbirth to kind of prevent any urinary retention or other complications. It is also worth mentioning that every woman's experience can be different. And the absence of the immediate urge to urinate may vary from person to person and from one childbirth experience to another. However, if you have concerns about your postpartum bladder function, or if you experience any discomfort or any pain while going to bathroom, please talk to your doctor and get appropriate guidance and support. All right, that is it for today. I hope this was helpful, and I will see you next time.